Hello friends. So the topic for today's lecture is muscles of the pectoral region. So in this session we will see what are the muscles that are present in the pectoral region, what is the origin and the insertion point of these muscles, what is the nerve supply of these muscles, and what is applied aspect of these muscles. Beside this, we will also discuss what are the various MCQ which you have been asked in your various entrance examinations. So let's start the class. So before going into detail of each and individual muscle, we should know what is pectoral region in fact. So pectoral region is basically the region of the anterior chest wall on which you have various muscles like and various tissues, various glands like mammary glands. So before going into detail, let's have what is the bony framework of the pectoral region. So because once we know about the bones, then we obviously it will be easy for you to know about the origin and insertion of these muscles. So in the pectoral region we have this bone which is known as sternum. So sternum is comprised of three parts. One part, the upper part, is known as manubrium. Then you have the body of the sternum. This is the body of sternum. Then this small triangular area is known as xiphisternum or xiphoid process. So this is known as xiphoid process or the xiphisternum. Then we in the pectoral region we have another bone, that is your clavicle, which you can see here. This is your clavicle. Then we have scapula, and this is your humerus. So these bones along with these ribs, they forms the bony framework of the pectoral region or the anterior chest wall. So now we will see one by one what are the muscles that are present in the pectoral region. So there are basically four muscles in the pectoral region. So the first muscle is your pectoralis major muscle. So pectoralis major muscle, because it is lying in the pectoral region, so the name is pectoral, and because its shape is quite large, so it is size is quite large, so it is pectoralis major. So we will see how the pectoralis major muscle is originating. So we have two heads of this pectoralis major. One is your clavicular head arising from the part of clavicle, and the one is your sternocostal head that is arising from the different part of the sternum as well as ribs. So we see the clavicular head. So this bone is your clavicle. So on the clavicle, the medial aspect of the clavicle, on the anterior surface, there arises the clavicular head of the pectoralis major muscle. Then from the anterior lateral part of the manubrium, anterior lateral part of the body of the sternum up to the sixth costal cartilage, there arises the sternoclavicular head of the pectoralis major muscle. So these fibers, they arising from the clavicle, they are arising from the anterolateral part of the sternum. Then the costal fibers, they are arising from the costal cartilage of second, third, fourth, fifth and sixth ribs. So the costal cartilage, they are also giving some fibers of the pectoralis major muscle from the second to sixth costal ribs. So these fibers, they are arising, and they are going to insert on the humerus, that is the lateral lip of the bicipital groove. So in the humerus, we know that at the upper end of the humerus, there is a groove known as bicipital groove. On that groove, we have two lips. One on the lateral side, that is known as lateral lip of bicipital groove. So on that lateral lip of bicipital groove, these fibers of the pectoralis major, they go and insert on the lateral lip of this bicipital groove. So the origin is from the different part of the clavicle and the sternum and the costal and the aponeurotic fiber. These aponeurotic fiber, they are arising from the external oblique muscle. So basically this external oblique muscle, this is muscle of the anterior abdominal wall. So some fibers of the pectoralis major, they are also going to arise from the aponeurosis of the external oblique muscle, and all these fibers, they go and insert on the lateral lip of the bicipital groove. So this is the origin and insertion of the pectoralis major muscle. In next slide, we will see how this pectoralis major muscle acts. So this pectoralis major muscle, if you see the clavicular fibers, these fibers, if they contract on the upper side, they will cause the flexion of the shoulder joint. So these fibers, the clavicular fibers, they contract like this and they will cause the flexion of the shoulder joint. So these clavicular fibers, they cause the flexion of the shoulder joint. Flexion of the shoulder joint. Then you have the sternocostal fiber. These fibers contract and they cause extension of the flexed, that already flexed shoulder joint is going to be extended by these sternocostal fibers. So if the fibers are acting individually, suppose only the clavicular fibers are contracting, this will cause the flexion of the shoulder joint. If there is contraction of the sternocostal fiber, this will cause the extension of the shoulder joint. So that will cause the extension of the shoulder joint. If muscle as a one unit act as a one unit, suppose the total muscle act as a one unit, this will cause the adduction and the medial rotation and the medial rotation. So if whole of the muscle acting as a one unit, the sternocostal fiber as well as the clavicular fiber, they both contracting together, they will cause adduction as well as the medial rotation of the shoulder joint. So this is the action of the pectoralis major muscle. Now we will see what is the nerve supply of this pectoralis major muscle. So pectoralis major muscle is supplied by, lateral pectoral nerve. So this nerve we have already discussed in brachial plexus chapter. So lateral pectoral nerve is a branch of lateral cord of brachial plexus, and the nerve root value for this lateral pectoral nerve is C5, C6 and C7. So one MCQ is asked on the nerve root of the lateral pectoral nerve, and another MCQ is asked what is the nerve supply of pectoralis major muscle. So you have to remember the nerve supply of pectoralis major is lateral pectoral nerve, and the root value of this is C5, C6, C7. So these are some MCQ which you will encounter in your entrance exams. So and the MCQ is about congenital absence of pectoralis major muscle. So sometimes it is very rare case, but sometimes pectoralis major muscle is absent, and this syndrome is known as Poland syndrome. Poland syndrome. So another MCQ is asked what is Poland syndrome, or what are the clinical features of the Poland syndrome. So one important clinical feature of the Poland syndrome is there is absence of pectoralis major muscle. Sometimes the pectoralis minor is also absent from this syndrome, and also the ribs from which it is originating, like the second, third, fourth rib, is also absent. So you have been asked in your exam what is the Poland syndrome, what are the clinical features of the Poland syndrome, and which muscle is not present in case of Poland syndrome. So they will give you different option, and the main answer is your pectoralis major muscle. So the pectoralis major muscle is absent in case of Poland syndrome. So the next muscle in the pectoral region is your pectoralis minor muscle. Because it is smaller in size, so in the name it is written minor. So pectoralis minor muscle is another small muscle of the pectoral region. So if you just dissect out the pectoralis major muscle, so deep to the pectoralis major muscle, in this image you can see this is the cut section of pectoralis major muscle. When you dissect out the pectoralis major muscle, deep inside the pectoralis major muscle, you will find a small muscle that is known as pectoralis minor muscle. So the origin of this pectoralis minor muscle is third, fourth, fifth ribs. So it originates from the third, fourth, fifth rib adjacent to the costal cartilage. So adjacent to the costal cartilage of third, fourth and fifth rib, there is origin of the muscle, a small muscle that is known as pectoralis minor muscle. So this pectoralis minor muscle is originating from the costal ribs of the third, fourth, fifth ribs, and it is going upward, and it is going to insert on the coracoid process of, this is the coracoid process of scapula. So this is going to insert on the coracoid process of scapula. The action of this muscle is, suppose the muscle is contracting like this will cause the protraction or anterior movement of the scapula. So the protraction and the, so the protraction and the anterior movement of scapula is due to the contraction of the pectoralis minor muscle. The nerve supply of this muscle is, by the medial pectoral nerve. So the medial pectoral nerve, that is a branch of medial cord of brachial plexus that supplies this muscle, that is your pectoralis minor muscle. So 2 MCQ in case of your entrance exams has been asked. One is, what is the nerve supply of pectoralis minor muscle? Next is your, what is the action of the pectoralis minor muscle? So pectoralis minor muscle, it draws the scapula forward and it also depresses the scapula. The upper part of the scapula is also depressed and the muscle is contracting in this direction. And the one is your about the nerve supply. Then we have one more question on the pectoralis minor muscle. That is, if you see in this diagram, pectoralis minor muscle is going to attach on the coracoid process. So it is providing a gap or a bridge over here, so that gives passage to various nerves, vessels that are passing and supplying to the upper extremity. So you can see a bridge is formed by the pectoralis minor muscle that is going to give passage to the nerves, the cords, the branches, the divisions of the brachial plexus, as well as axillary artery and axillary vein. So these vessels are passing under the pectoralis minor muscle. So another MCQ has been asked in your exam, which muscle forms a bridge to give passage to the structures that are passing to the upper extremity. So the answer will be your pectoralis minor muscle. Again, another question is asked, that is, which nerve divide the axillary artery? So axillary artery is divided by, the question is asked, which muscle divides the axillary artery? So axillary artery is divided by a muscle, that is your pectoralis minor muscle. So this pectoralis minor muscle divides the axillary artery into 3 parts: the proximal part, the part behind the muscle, and the distal part that is going behind the, this is going distal to this muscle. So pectoralis minor muscle divide the axillary artery into 3 parts. These are some MCQ which is asked in relation to the pectoralis minor muscle. So one is about the origin, then insertion of the pectoralis minor muscle, and the question is asked about the nerve supply of pectoralis minor muscle. Next question MCQ is framed on the action of the pectoralis minor muscle, and the important question or MCQ question is that which muscle divides axillary artery. So axillary artery is divided by pectoralis minor. The answer is pectoralis minor muscle. So these are few MCQ which has been asked in your entrance examination in relation to the pectoralis minor muscle. So next, in the pectoral region, we have a very small muscle that is known as subclavius. So sub means below, and clavius is something related to the clavicle. So the muscle, a small muscle related to the clavicle below the, or the under surface of the clavicle, is your subclavius. So this is a small horizontal muscle. It is originating from the origin of this muscle is from the first rib, and it is going to insert on the subclavian groove. We have a subclavian groove on the under surface of the clavicle. If we have seen the clavicle, So on this clavicle, on the under surface of clavicle, we have a groove that is known as subclavian groove. Subclavian groove. So the margin of this groove gives attachment to the subclavian fascia, that is the fascia of this subclavius muscle, and the under this groove, the space, this groove gives insertion to the muscle, that is your subclavius. So subclavius is inserted in this groove, that is your subclavian groove, lying on the under surface of the clavicle. So this is a subclavius originating from the first rib and going to insert on the under surface of the clavicle, that is in the subclavian groove. So the basic function of the subclavius is it basically stabilizes the clavicle during shoulder movement. So during the shoulder joint movement, it stabilizes the clavicle. So it is basically a stabilizer of the clavicle. Next we have a very long and important muscle, that is your serratus anterior. Though serratus anterior does not comes in the pectoral region, but because it connects the axial skeleton to the appendicular skeleton, that is why it is studied under here. Because all the other muscles like pectoralis major muscle, pectoralis minor muscle and subclavius, they are also known as anterior axio-appendicular muscle because they are connecting the axial skeleton to the appendicular skeleton. So serratus anterior is basically an anterior axio-appendicular muscle. Appendicular muscle. So you can see here, these are the ribs. These are the ribs. So the serratus anterior originates from the first upper eight ribs, in the plane of mid axillary line. So in the plane of mid axillary line, you will have the origin of a muscle that is known as serratus anterior muscle. So this is serratus anterior muscle originating from the upper eight ribs, and these are in the form of serration, because each muscle part is arising from the individual rib, so they form a serrated appearance. That is why its name is serratus, and because it is lying on the anterior side, so it is known as serratus anterior. These muscles arising from the anterior or the mid axillary plane of the ribs from 1 to 8 ribs, and they are going back and they are going to attach on the if you remember scapula. So we have in the scapula we have the costal surface, and the medial margin of this costal surface giving insertion to the muscle, that is known as serratus anterior. So at the point of insertion, the serratus anterior is inserting in the form of digits. So the first digit is inserting onto the superior angle of the scapula. The second and third digit, they are inserting on the medial border of anterior surface of the scapula. The fourth, fifth, sixth, seventh and eighth digitation, they are going to attach on the inferior angle of the scapula. So this inferior angle of the scapula is giving insertion to the lower 5 digits of the serratus anterior. So this is the insertion point of the serratus anterior muscle, whereas it is originating from the upper 8 rib. Now coming on to the action of the serratus anterior muscle. Serratus anterior muscle is basically a muscle of abduction. So it causes abduction. So we know that the abduction of the shoulder joint is carried out various muscle. The first 15 degree or the initiation of the abduction is done by supraspinatus muscle. So the supraspinatus muscle is responsible for first 15 degree of abduction of the shoulder joint. Next, up to the 90 degree, it is carried out by the deltoid muscle. So up to 90 degree, it is carried out by the deltoid muscle. After 90 degree, when you rotate the scapula and you do the overhead abduction, This is carried out by the muscle that is known as serratus anterior. So this serratus anterior is responsible for the overhead abduction. Overhead abduction. So you will be asked in your exam about how the abduction of the shoulder joint takes place. So you have to define in this point how the abduction is initiated and what is the muscle responsible for the abduction up to 90 degree. Then overhead abduction is done by the serratus anterior muscle. So these three muscles you have to remember whenever you have to describe the abduction on the shoulder joint. So the nerve supply of this muscle is your nerve to serratus anterior, nerve to serratus anterior, or it is also known as long thoracic nerve. Long thoracic nerve. So nerve to serratus anterior is basically it is also known as long thoracic nerve. It supplies the serratus anterior. It is arising from the roots of the brachial plexus. So you are often asked in your exam the root value of long thoracic nerve, how the long thoracic nerve is formed, and what is the nerve supply of serratus anterior muscle. So the root of C5, C6 and C7, they form long thoracic nerve, and this nerve supply the muscle that is known as serratus anterior muscle. So this is all about the serratus anterior muscle. Sometimes this long thoracic nerve is injured and there occurs the paralysis or the action of the serratus anterior is lost, and this leads to a clinical feature that is known as winging of scapula. So in your MCQ, it is also one more important question, what is winging of scapula? So winging of scapula is basically a clinical feature of paralysis of serratus anterior muscle. The long thoracic nerve or nerve to serratus anterior is paralyzed or injured. Serratus anterior is injured, and this lead to paralysis of serratus anterior muscle. This causes the medial border of scapula. What happens in this? The medial border of scapula is laterally rotated and it shifted to the posterior side. Suppose this is a scapula, this is the medial border of the scapula. In case of winging of scapula, the function of serratus anterior muscle is lost, and this lead to the posterior and the lateral shifting of this medial border of scapula, and this is somewhat a wing shaped structure. That is why it is known as winging of scapula. So their frames, they often frames one important MCQ about the winging of scapula. Which nerve is injured in case of winging of scapula? Then your answer will be that is your long thoracic nerve or nerve to serratus anterior. In other words, they ask which muscle is paralyzed in case of winging of scapula, and then your answer will be serratus anterior muscle. So this is some important feature, the origin, insertion, nerve supply, and the action of the serratus anterior muscle. So in this slide, you can see a summary of complete the total muscles or the pectoral region, that is your pectoralis major, pectoralis minor, subclavius and serratus anterior, from where they are originating, from where they are going to attach. So in case of pectoralis major, you have the clavicular head, you have the sternocostal head. They are going to attach on the lateral lip of the intertubercle sulcus or the bicipital groove of the humerus. The nerve innervation is lateral and medial pectoral nerve. You have to remember these root value for your MCQ. Then the main action of this pectoralis major is adduction and medial rotation of the humerus. Otherwise, if the muscle is acting individually, the fibers are acting individually, then the function differs. Then you have next muscle, that is your pectoralis minor muscle. It arises from the third to fifth rib near their costal cartilage, and it is going to attach on the coracoid process of the scapula. The nerve supply of this pectoralis minor muscle is your medial pectoral nerve. The root value for this is C8 and T1, and it stabilizes scapula by drawing it inferiorly and anteriorly. Then you have a small muscle, that is your subclavius. It is arising from the first rib, getting inserted onto the subclavian groove of the clavicle. The nerve supply of this muscle is subnerve to subclavius, that is also arising from the upper trunk of brachial plexus, and the nerve root value for this nerve to subclavius is your C5 and C6. It anchors and stabilizes the clavicle. Then you have the serratus anterior. It is having a vast area of origin, that is from first to eighth rib. Then it is going to insert on the anterior surface of medial border of scapula. The nerve supply is long thoracic nerve, that is C5, C6, C7. It is basically acting as a protractor of the scapula and also the abduction. So the abduction of the shoulder joint, the latter half of the abduction of the shoulder joint is by the latter half of the abduction of the shoulder joint is done by the serratus anterior muscle. So all these headings are basically your MCQ, where it is what is the origin of these muscle, what is the insertion point of these muscle, what is the innervation of these muscle, and what is the main action, and what clinical feature appears if the muscle or the nerve is injured. Then the clinical aspect, I have already told you that one is your Poland syndrome, where you will find there is a congenital absence of pectoralis major muscle. Then you have winging of scapula due to injury of which nerve? So the nerve involved over here is long thoracic nerve, and the muscle paralyzed is your serratus anterior. So this serratus anterior muscle is paralyzed, and there occurs the lateral and posterior shifting, or the position of shifting of medial border of scapula. So all these points become your important MCQ. So you have to remember which muscle is paralyzed, what clinical feature appears during the muscle paralysis or the nerve injury. So that's all about the muscles of the pectoral region. This you have to prepare for your Viva exams, for your MCQ exams, or whatever entrance exams you have been find one or two MCQ on the muscles or their action, the nerve supply of the pectoral region. So that's all about today's class. So hope this will be very informative to you. Thank you.